Values are the very essence of why we're here. It drives our desire to improve people's health. It drives our desire to make them whole persons.
When you have the lineup of the institutional named values in an individual's core values, that's when you really can strengthen both the performance of the institution and the satisfaction of an individual.
You're the future of healthcare. And here at Loma Linda, we are trying to create the future of healthcare. The future of healthcare is so dependent on a very synergistic group of people working as a team.
For all of our actions and interactions with patients, with families, the core is to live our values.
When you look for an occupation, it's so much more important to feel engaged in what you're doing and to sense the importance of what you're doing.
You may come from any number of religious backgrounds, but the thing that sort of glues us all together is this open acknowledgement that God has tasked us to serve others.
This is a special place. We're value-driven. It's a chance for employees to live their values and to reach out to patients and share those values. You don't get to do that in many organizations. That's what makes this place an organization that people want to work at.
People that come and choose to work here, they choose to come here because Loma Linda has a mission that's unique, that there is something more than just physical and mental needs. There's a need for hope, a need for the promises that we can convey to them, promises that are really only available through a spiritual source, the promises of Jesus Christ.
The difference at Loma Linda is that we are trying to strengthen each other, that those values are coming from a relationship with our Lord.
When I come to work in the morning, I realize this isn't just another job. It's an opportunity to change people, to make them whole.
Really, when you take all of our values and you want to wrap them up into a single thing, it's really about caring and serving others. So when a person is driven by that and their sense of satisfaction and their own personal wholeness is driven by those values, that's when that person, who may have come here for any number of reasons, that's what drives that person to stay.
This is a place that worldwide seeks to make a difference in people's lives. What we do on this campus, we also try to do to better the lives of people around the world. That's an organization I want to be a part of. It gives value to my life, and I know it does to so many other people who work here.
It was 100 years ago when our founders envisioned what we were. That vision, if put in words, would read like the values we have articulated for our institution.
Compassion is having a deep understanding for someone else's situation and having empathy for them.
Understanding what a person is going through is key in helping them. I have to listen to them to know what they need.
I try to imagine how I'd want my children or my neighbor's children to be treated. That's what motivates me every single day.
I try to greet everybody with a smile and be as helpful as I can. I am the first person that they see here, and I want to make them feel at home right from the start.
Compassion is how we show God's love. It's in the little things we do that shows how much we care.
Well, I chose to be an ICU nurse just because I love the baby so much. I took care of a baby. He had no name, he had no mom, he had no brain, and he literally had no hope. That day I was talking with some other staff members, and I just thought, it's just not right for this baby not to have a name. He came from the Lord, and he's going to go back to the Lord, so his name should be Christian. I went back to his bedside, and I made him a name tag for his bed, and it was a beautiful name tag, and I put a sticker on there just saying, when the Lord's with you, that you're never alone, He just brings out the love in your heart because he's just such a beautiful, perfect, he just seems so perfect. And anyway, the doctors felt that there really wasn't more we could do for him. We were just kind of waiting for him to die. The nurses who loved him just felt that, if he doesn't die here, they're going to send him to a facility and he's going to die alone. I So one of the nurses who signed up to be his primary decided to get emergency foster care status and take him home. And he lived till 2 days before he was 6 months old. He was almost 6 months old. And he passed away in her arms, in her loving arms. Makes me want to cry. You know, that baby didn't have a long life, but he touched the hearts of so many people. And I just realized that, you know what, no matter how much experience you have, that you can make a difference in somebody's life. And I think if you do your job with your heart, then you make a difference.
Patients put their lives in my hands. There's no greater trust than that.
I have a great responsibility to keep their trust and do the best I can.
Patients need to have confidence in their treatment and believe they will get better.
That can only happen when they have trust.
I demonstrate my integrity by keeping my commitment. If I say I'm going to do something, I'm going to do it.
I believe in integrity.
It helps to know that someone greater is always watching, guiding us to do the right thing.
Here at Loma, I've been very proud of the fact that we don't like to hide things. We are very transparent. If we isolate a problem or an area where we can improve, we will work towards that. There was an area in our practice that we weren't up to par. We had some room for improvement. And instead of ignoring this area or dismissing it, we focused on ways to improve it and focused our efforts. Our goal is to make sure that every patient receives the best care they can. And I feel that by providing physicians and nursing and all staff related to patient care with the means and the tools to improve patient care while meeting certification requirements and ensuring that our patients trust us, that I fulfill the value of integrity. If a patient leaves here feeling anything less than having received the best care for them as a person, not as a sick individual, not as someone that needs medical treatment, but as a person, then we haven't done our job.
We believe in excellence in everything we do.
I take pride in my work is that little things that count.
We pride ourselves on exceptional and visionary work, the kind that comes from our commitment to research and education.
We set high standards for ourselves.
Standards of excellence.
And no matter how high, we find a way to achieve them.
My role as a medical interpreter is provide safe communication, being a message clarifier between the providers, the patients, and every kind of professional we work with in the hospital. So I remember there was a time when there were not interpreters available at night. I remember one instance when a baby was discharged during the night hours. These parents took this baby home, and 2 days later we got a phone call from them, and he was asking if we could provide more medicine. We called the pharmacy, and the pharmacist called to our attention. The medicine was given to this baby was supposed to last 10 days, and it was only 2 days after discharge. They had run out of medicine, but fortunately everything turned out well. So it is so important to be accurate and to be so excellent in doing this for our patients, so we don't have to face mistakes. Excellence means to me to do things the right way in every aspect of our lives here every day. To be able to provide that service to the patients knowing that we are doing the right thing all the time. And that's the kind of service we provide here in Loma Linda Hospital.
I'm excited to go to work every day because I enjoy the people I work with.
I may be just one person, but I'm part of a team.
A team with a mission to help,
to heal,
to comfort.
I am part of something greater than me.
Because it takes a team to fight disease.
A team with one mission.
To make each patient whole.
We walked into a patient's room. We were just saying hi. And off to one of the sides, they had this little girl. So my dog just hopped right up on the bed next to her and just laid right down like he always does. And the girl just leaned over and she's like, "Oh, doggy." The mother is starting to cry and the grandmother's starting to cry. And the nurse is even crying, the rehab people are crying. And apparently this little girl, who's about 4 years old, had had brain surgery about 2 weeks before and hadn't spoken a word since. It's then that you realize that, you know what, I'm not just security here, it's not just a dog, it's not just another doctor, it's not just another nurse, you're all part of something bigger. Because if you just had one doctor dealing with one patient, they wouldn't get the care that they need from a nurse or care that they need from a rehab person or someone else that may step. It could be the volunteer who delivers a book or someone that comes in to read for a few moments. Anybody that wears that Loma Linda ID, anybody that works here, anybody that volunteers or comes in or just says hi and turns over their shoulder and, "Hey, how are you doing today?" is part of that team is making this a better place. You bring in a whole new aspect to them and maybe just, my day is just a little bit, not much lighter. Huh. You like being part of the team, I know you do. Yes.
We are a part of a faith-based ministry. Because of that, we treat the whole person. That means not just the body, but the mind and the spirit.
Whole person care is dealing with all aspects of their life, which means taking into account their family too.
By living a healthy and positive life myself, it makes it easier for me to convince others of what difference the right attitude can have.
When I'm happy and upbeat, that can be contagious. And in some small way, that's how I know I'm helping patients and their families. I know I'm making a difference.
We don't treat diseases, we treat people.
This is not just a place to go when you get sick. It's a place to heal and be whole again.
My primary role is as a physical therapist. I get an opportunity to work with families and children. When I wake up in the morning, sometimes we don't always feel good, but I know that I have a family counting on me, and I myself have to be complete and whole as I go into my treatment. One of the greatest challenges is they come in and they're scared, and then once they see when we pull out the balls and the swings and the trampolines, or we head out to the park, they become a child again, and the family relaxes and the child relaxes. So we'll evaluate them and we'll look at them and see the areas that they need help with, and the families as well. If the family needs someone to pray with them before, we'll have an opportunity and we'll pray with them. As I treat the whole person, it allows me to see the whole body as a child. So I'm not just working on one part, the leg, the arm. I'm looking at how that little one is going to function. They have a life skill. They're part of a family. Their life role may be to be a brother, to be a child, and I want to make sure that they can have those opportunities.